on that one.
Okay, and this is Representative Turner's bill. Okay.
Yes.
All right.
3376.
Okay. Good morning. Thank you for the opportunity to testify. It's afternoon now. Sorry. As you know, Texas Impact and Billy Hamilton and Methodist Healthcare Ministries have prepared fiscal and economic impacts if Texas were to use federal Medicaid dollars to extend health insurance to low-income adults. We did not start our work with the assumption that we should expand Medicaid. Instead, we started with questions about what would happen if we did. Much of the testimony that you've been hearing includes information and conclusions that come from the work of our colleagues and our own staff. Expanding Medicaid makes great sense. It saves locals money, it cuts insurance costs for everyone, and it frees up GR. Texas Impact has bent over backwards so far not to make a moral case for expansion. Faith communities are universally committed to caring for the poor and disadvantaged, but we felt we owed it to ourselves and to you to work through the numbers. So today what I'm here to say is we have given you about all the numbers we're able to give. No one here is making a serious case that Texas comes out better for not taking the federal Medicaid money. No one has suggested that Texas is better off if poor people are uninsured. Instead, what we've heard all session is that opposition to the expansion is ideological and that it goes against certain principles and it's politically sensitive. I need to say that it's morally sensitive for 26 million Texans to watch lawmakers throw away billions of dollars that we have paid in federal taxes and that are intended to take care of the members of our Texas community. It's morally sensitive for 26 million residents of Texas to see our neighbors suffer and know that there were resources to prevent and alleviate the suffering, but that our state rejected those resources. So we support Representative Turner's bill, and we will support Representative Zorwas's bill. We know that some of our colleagues are going to have reservations about some of the provisions. We think it's really important that you move forward with something on taking the federal money to cover low-income people. We don't have strong feelings about how you get the job done or what you eventually call the program, as long as it has a meaningful benefit package for the people who the federal funds are intended to help and doesn't impose onerous costs on them. What we have very strong feelings about is that you should not leave on sine die without a plan. You can't leave 1.5 million Texans' futures on hold while state leaders work out a politically sensitive compromise. And there's no option to remain neutral. If you all don't make some decision before sine die that provides a way forward to ensure low-income adults using the newly available federal dollars, you will instead be making an affirmative decision to keep more than 1 million of the poorest Texans uninsured, and that will be a decision that it will be hard for everyone to live with. So thank you.